Greetings from Narayana Multispecialty Hospital, Mysore. A very warm welcome to my dear colleagues from the Department of Cardiology. Here from Department of Cardiology, Narayana Multispecialty Hospital, this is a special FB Live program where we are on the discussion on the topic World Heart Day. So the World Heart Day is celebrated every 29th of September every year for the last 18 to 20 years. And today in the discussion, I have my colleagues from Department of Cardiology. At the outset, I am Dr. Anand. I am consultant cardiologist, pediatric and adult. I have with me senior consultant cardiology, Dr. V. Keshavamurthy, and my colleague, Dr. Srinivas P, who is consultant interventional cardiologist here with us. So today we thought from the Department of Cardiology, we would like to brief you upon the significance of the World Heart Day. So the theme this year is Use Heart for Every Heart. So I would request my colleagues that what is the significance of the World Heart Day, which is conducted, which is observed every year across the world.
Thank you, Anand. So, very warm greetings from Narayana Multispecialty Hospital. Friends, World Heart Day is the awareness campaign which is given by World Heart Federation every year. World Heart Day is celebrated on the last week of September month of every year. This year we are celebrating on the 29th of September of this year. World Heart Day, the main purpose of World Heart Day is to create the awareness in every individual about the heart diseases, the severity of heart diseases, and to create awareness how to prevent the heart diseases. One of the important thing what everyone has to understand is heart disease is the number one killer disease in the world. Every year, around 18.6 million people are dying with the heart disease and vascular disease related diseases. So, being a number one killer, the awareness about this disease is very poor among the public, and more so in the developing countries. 70% of these deaths occur in developing countries like India. So, one of the most heartening, one of the most important thing about this is about 80% of these deaths can be preventable if you create awareness about the prevention of the heart disease. With this purpose, the World Heart Day is carrying on this campaign every year since last 20 years across all the countries in the world to every public how to prevent the heart disease, how to live to have a healthy heart in their population. So this is about the World Heart Day and World Heart Day campaign.
So, greetings to all. As we know, every year the World Heart Federation comes out with a beautiful theme so that we cardiologists can promote this theme amongst the public. We have a very interesting and nice theme this year, Use Heart for Every Heart. So, we have three pillars in that. So, what does it mean? So, use heart for nature, use heart for yourself, and use heart for humanity. As we have already discussed, unfortunately, 2/3 of all these cardiovascular deaths are happening in the low to medium income group countries, which are essentially preventable. Majority of these are preventable. So we are now looking at the base of the pyramid. We are now focusing on the preventive aspects of heart disease. Once a person develops a heart attack, there are all chances that his lifespan could be cut short. So we are now focusing on the preventive aspects. So we will discuss in detail in the coming few minutes or so how to prevent heart disease and what are the steps to be taken to lead a healthy lifestyle.
Okay, so we were talking about three pillars in the theme this year, which is Use Heart for Every Heart. So what we need to look into it is just not encompassing just the heart health or the health of the human being or the individual alone. Here we are looking at also at the community at large or the humanity. We are looking at the nature and also at the self. So what would you like to talk about the first two pillars, that is one on the humanity and the one on the nature?
Yeah, actually, the use heart for the humanity is a very broad term. It's not only doctors has to, because somebody goes to the hospital, they spend money, doctors to take care of heart. This is a very wrong concept in the public. The World Heart Day very clearly says everybody in the society should care for his fellow's heart health. For example, a father in the family should think of his whole his wife and his kids how their heart health, what is the future aspects of heart diseases, how to inculcate the important preventive measures in the family. A teacher should able to carry out certain preventive measures in the students, how they will, or how they should live a healthy heart in the future, how to prevent the heart disease in them when they become adults. Similarly, every person in the society should able to think about this, how everybody will take responsibility to have their fellows, their colleagues, their friends live happily with a healthy heart. That is the use heart for the humanity. To tell you further, for example, a person in the family, if checking his parents for a healthy heart packages and checking his heart, what are the risk factors are there, treating them appropriately like diabetes, hypertension, and he himself indulges in stop smoking and going for a walk, taking all family members for a walking or a trekking or a trip. And these all things are a long way to go. It is not just talking about some superficial things. It is the important behavioral changes in the whole society that everyone has to join hands to live happily, to have a healthy heart in the future. For example, in our nation, like now, our hospital. So our hospital management or the head should take up a response that how to have a physical activities for the staff. We have so many staffs in the like nurses, health workers. A lot of people are there. Involve them in the heart healthy activities and offer them a packages so that we can check everybody's heart at a very very throwaway price. We have a lot of programs like that. Like we have a package introduced in this year with a very throwaway price with a heart checkup packages, doing echo, ECG, lipid profile, sugar, like that. Lot of things, long way to go. Not only one hospital, not only one doctor. It's every office, every school, every family should involve in this heart healthy behavioral changes. This is the one arm. Second arm, I think my colleague will tell.
There was another aspect of this, use heart for nature. Now, where does nature fit into heart health? See, I think we have meddled too much into the nature, and I think nature is taking revenge. The one important killer, often neglected, is air pollution. Air pollution is causing almost 20 to 30% of cardiac deaths. It's an abstract thing which we are not really bothered about. Why don't we use cycles for short walks? We can go for a walk. See, when you are going to a nearby place, your grocery store, we can walk. We can just walk down the road. We can use a bicycle. We are rarely doing it. We are all using motorbikes. We are using cars. We are causing so much air pollution that air pollution itself today is one of the major scourge of heart illness. And so I think we have to take care of nature so that nature takes care of us. This is a very important aspect of prevention of heart disease, often neglected. We have to keep our air pure.
So, as Dr. Srinivas has briefed upon the importance of nature and how to, because we know that pollution itself directly or indirectly causes around 7 billion deaths, and around 25% of these directly or indirectly lead to the cardiovascular deaths. So, all the more, this is an important cause which needs to be addressed, which has to be emphasized upon. And the other thing, what Dr. Keshavamurthy has been telling about the pillar one, which is for humanity, heart, the use heart for every heart for the humanity. In this case, there is also some amount of inequity. So there is that the people who are in the cities or in the towns are able to get some healthcare access, but the same people in the rural areas or people who are in the low economic areas are not having enough exposure. In that matter, I think we are proud to say that in Narayana hospitals, we are trying to cater across the spectrum of people from the rural areas as well as the urban areas since the inception in the last 10 years, be it any kind of healthcare packages or be any care of intervention procedures which we are able to offer to them. So now as we go forth, we would like to look that
One more.
so the last arm what we are looking here is the pillar 3, which is called for yourself. So having talked about heart for every heart, so we are talking about for the humanity and for the nature as such. So what about yourself? So we have to take, if everybody starts understanding this and starts taking care of themselves, that is also equally helpful. So about the last pillar, which is for yourself, so what would you like to tell? What are the concepts of it which the World Heart Day wants to emphasize this time?
So this is the most important pillar in these three pillars, because use heart for yourself. It looks very simple message, but it's not as simple as that. Every individual, for that matter, not only doctors, not only medical field people will go and check themselves. Every individual, whether it is a laborer whether it is a lawyer, whether it is a police, whatever the profession is, every human being should know about his own health. If you ask somebody, some movies released in 1980s, they will tell who is the director, who is the producer, everything. But if you ask him what is his blood pressure, he doesn't know. What is his sugar, he doesn't know. What is his blood, doesn't know. This is unfortunateness about our awareness about the health in our population. So the purpose is everyone, for that matter, everyone beyond 30 years should know his blood sugar levels, should know his BP levels, should know his cholesterol levels, should know his ideal body weight. He should know how much he is eating per day, what calories he'll put on, what is his exercise capacity what is his step count per day. All these things, awareness has to be created to every individual. So this is the about to know your heart by yourself. Apart from that, you should also see that everybody should refrain from smoking. Smoking should be stopped 100%. And also you should not allow anybody around you, whether it is a friend or colleague or in a hotel, in a public place, you should not allow anyone to smoke, because passive smoking also equally kills the people. So this should be the awareness. One should have very strong awareness about our own health. Everyone should check ourselves, should know our numbers, should know the hard preventive measures. One more thing I want to add in this, our dietary habits has been looked into. This is very, very important. For example, eating every day processed food, food high in the calories, high in the sugars, like colas, like fried foods. There's nothing fashion in there, nothing greatness in this. One need to think that this is not the healthy food. We need to tell ourselves it's not healthy food. Occasionally is okay. Daily should not be indulged in this junk food. We should put ourselves to the effort to eat lot of fresh vegetables, fruits, non-processed food. So, and go for regular physical activities, go for walking, involve in meditation, yoga, stress-free life, and have adequate sleep, more than at least 8 to 9 hours sleep per day. All these things we should start developing, start doing ourselves, and to live long.
Yeah, we will be discussing these things in the coming minutes. So, as Dr. Keshav told, know your numbers. That is very important. It's not your mobile number or your bank account number. Know your numbers. There are some 5-6 things. Very simple. Your blood sugar, your cholesterol, your lipid profile, and very important. Have a tape. Just measure your waist. We have numbers there. 102 centimeters for a female, 88 centimeters for a male. This is the maximum which is acceptable. Just measure your weight. Use a mobile app. You can calculate, and please take advantage of all the gadgets we are available now. There are simple watches available which can be so handy for you. It can tell you a lot of things about your health status. So I think this know your numbers is very important, and it will go a long way in preventing heart disease in you and in the community.
True. So as you said, having clear details and to know about it, so that you yourself as an individual stay an example, so that people around you in the family and in your workplace try to emulate you with your healthy diet pattern and the healthy stress-free way of life. So going forward, we have been always, cardiology is the most common scourge in this is heart attacks or myocardial infarction. So we know that it is unfortunate fact that the people from the subcontinent, be it India, the age group of people who get affected by heart attacks is at least 1 decade earlier than the people in the Western community. So, what would you like to talk about it as we talk a small discussion on heart attack in the young population?
Yeah, this is the most very disturbing fact what we are seeing nowadays. When I was doing a postgraduate, we used to see all old people, 70 plus, 60 plus, used to come to the hospital. Now, of late, since last 1 decade, we are seeing people are coming with 40, 30 years, 35 years, 40 years, 4 decade, commonly 4 decade, coming with a heart attack. The problem with people coming with a heart attack is they are the very engaged, they are the pillars of the family. When they get affected with the heart attack, whole family, economy, everything will be destroyed. So we have to look into this, why the heart attacks occurring in the young, what is the problem. We need to, if you look into the deep into it, few facts will come into the picture. The cause for the heart attack in the young will be one of the most important of the lifestyle changes. Nowadays, the most problem will be the sedentary lifestyle. Everybody is sitting in front of the computers, in front of their office laptops, with the mobiles, starting from the childhood, housewives to the, not that it's only in the cities, even the villages it's same. People are sitting in the mobiles for hours together, watching TV for hours together, not having any physical activities. Sedentary lifestyle is one of the biggest problem for the heart attacks in the young. Second thing is the smoking. If you see the urban metro cities, smoking is rising very rapidly, especially in the females. So it's become a fashion, it's a style statement that smoking, they think they're very great who smoke. So this attitude should come down. Smoking is a second problem, increasing the heart rate in the young. Third one will be the dietary changes. When we are olden days, the food was just to live. They used to eat only 2 times, 3 times food, that too with a low calorie, low fat food. Now the food is available everywhere. I think eating it's become a compulsion for everybody. Eating all the time, talking about food all the time, indulge in food all the time, and Swiggy, all these apps are available. People are ordering and eating indiscriminately. I joke to the patients. You olden days, 1 week person used to eat. You know, people are eating one day, 1 week food, 1 week calories used to eat one day, and that's why because of this overeating, high calorie, high fat food, people are putting on weight. Overweight is becoming a big problem, and because of the overweight, sedentary lifestyle, diabetes is coming in explosion. A lot of people become diabetics. A lot of people have got high cholesterol levels. All these risk factors emerging. There are new emerging risk factors like lipoprotein, small a. All these things will put together is making heart attacks in the young is become very common, very problematic, and it's destroying our country's economy.
Yeah.
Essentially, genetically, unfortunately, I think we Indians are prone to develop heart disease at a much younger age, as Dr. Anand just mentioned. And also, what we are seeing is the nature of the heart disease is quite severe. They tend to do bad. They have what we call diffuse disease, and that's the unfortunate thing. See, if you just go by statistics, we Indians are almost 20 times more prone to develop heart disease than Japanese. Almost 5 to 10 times more likely to develop heart disease than Americans or Europeans, and that too a decade or so earlier than them. So, as we have already discussed various causes as to the cause for this explosion of heart disease in young. One thing is, I think we have gone into a rat race. There is a people have high goals, and this constant stress. This stress, because in a generational change, if the incidence has to go up so much, there has to be some external factor, and we feel that stress is contributing a lot, because people live in a constant stress nowadays because they have unrealistic goals. They are always into some race. They want to outperform others. So I think all these things are contributing to this scourge. I think the stress and lack of sleep, lack of this calmness is not there in the current generation. So that is probably hitting them.
So, as we had discussed now, so heart attack in young, I think there are, as we all agree, there are some modifiable risk factors and there's some unmodifiable risk factors. Among the modifiable risk factors, I think a little more importance has to be given for smoking, because I would like to tell, even today morning I had to do early morning I had to do an angioplasty for a 35-year-old male who was just, the only risk factors in him was smoking. Otherwise, an agriculturist who was not overweight, who was into physical activity, but was a heavy smoker. And the kind of disease which he had was somebody who would normally see in somebody who was 60 to 70 years of age. So here is a person who has misused his life by smoking all the time, and this has caused got a very bad disease and caused some kind of a heart dysfunction which is going to affect his productivity for the rest of the life, which is very important. And the other thing what Dr. Srinivas has told, the psychological stress in the present lifestyle, in the present generation, is a starting point. It's kind of a spiral. A person who is having a lot of stress in work may not have a good amount of sleep. He tends to overeat. There is a tendency to keep awake, there is a tendency towards alcohol and smoking amongst them. So sometime down the line, some amount of mindful living, that is a key thing which the youngsters should take. They should get themselves involved in physical activities, in meditation, in pranayama. All these things go a long way in helping them, definitely. You would all agree that. So going forward, let us look at a few of these same factors, which because most of them play a key role, because the whole key of the discussion here is how to prevent heart diseases. So what would you like to tell about exercise here?
Okay. So, Anand, it's a very important thing that we have opened up the discussion exercise, because after the recent demise of a famous actor in Karnataka, a lot of discussion on the exercise, good, bad, a lot of people have become stressed on exercise. So, to speak exercise is not that going to gym and doing heavy weights. Exercise is not only that one. Exercise is doing a household activities, gardening, going for jogging, walking, everything is exercise. So exercise is not only going to gym. That's first concept. Second concept is any physical activity for that matter. It can be called as exercise. Any physical, every person should need a minimum physical activity for his routine life. The physical activity has to be started and it should be gradually increased. For example, what is happening here is people will not go to the gym. They will just suddenly join the gym once in a while, and especially in the weekends, they do gym for 2 hours, 3 hours, and they want to compensate for 1 week and they go and relax for 1 week. In this 1 week, they will never get up, never walk, sit in front of computer all the time. Because of this, it's happening too much stress on the heart, developing a lot of issues. Apart from that, there are some peculiar heart diseases where the exercise can precipitate some catastrophic events in them. For example, somebody has got a silent coronary disease, somebody has got a hypertrophic cardiomyopathy, somebody has got a hypertrophic obstructive cardiomyopathy, somebody has got prone for exercise-induced arrhythmias. These are the people, when they go for exercise, they may land up in problem. That's why before going for any physical, any what we call intensive exercise program, please go to a cardiologist, check yourself, and look for all these risk factors. If the risk factors are not there, you are safe to do the exercise and activities every day, gradedly. Is very important. You have to train yourself slowly. For example, if you're doing a treadmill, start with 15 minutes for few days, then go to 30 minutes, then go to 45 minutes, and increase the speed. Not to go with the high speed with like a movie, what they show in a movie clips, go for intense exercise in a first day itself. Graded exercise is advisable, and regularity should be advisable and should be done with a after the cardiologist evaluation for a intensive workout, and regularity is very important. This is what I want to say about exercise.
True.
Yeah, I think they rightly said. See that endurance and increasing step by step is very important. Even in fact, we have set some goals. See, for example, we don't want you to exercise vigorously all the time, 1 hour, 2 hour, late night. There are certain things. See, please don't exercise late in the night after a heavy dinner. We have seen many people collapse on treadmill while doing so. Don't exercise after a full meal. Don't go in very cold, breezy weather. So what we want is, see, for example, if you are busy or whatever is your lifestyle, 30 minutes of a moderate level of activity. See, that may include your brisk walking, cycling, jogging, swimming, any of these things, any of such activities. 30 minutes a day is good enough. At least 5 days a week. This is what we want. And if you are into intense physical activity, at least 15 minutes a day for 5 days a week is what we scientifically, our scientific bodies is what we recommend. So that maintaining this for most part of your life is very, very important. So that exercise, and that is, we have something called sitting disease. In fact, there is a new syndrome coined called sitting disease. So people who sit for almost 8 hours continuously in a day, the risk amounts to, I mean, almost smoking 8 or 10 cigarettes. So that's what it's very startling. But sitting constantly, the sedentary lifestyle is one of the major cause for this explosion, I think.
You call the sitting. Sitting is the new smoking.
Correct.
Sitting is the new smoking. So the key word here is whenever somebody wants to take up exercise, so you need to do it graded, and as little older, as even in the third or fourth decade, everybody is welcome to start doing exercise, but sometimes it has to be supervised, and you have to get evaluated prior to start of exercise. That is the key here.
One more myth I want to say in this, in the continuation. People will say walking is only for the people who are fat, who eat a lot of food, or who are diabetics. Other people need not do anything. This is a wrong concept. Every individual for that matter, whether it's a thin man, whether it's underweight, whether it's overweight, whether you have whatever even though don't have any other reports are common, still physical activity is a part and parcel of the lifestyle. We need to inculcate that physical activity. If you talk about steps, at least 5,000 steps per day is very important. That should be the recommendation.
Okay. So having moved upon exercise, so equally the other half is about sleep, quality sleep. So this is often neglected. We talk about rest of the risk factors, but sleep is taken for granted on another means. In the present generation where, as a lot of expectations, we curtail our sleep or our faulty sleeping habits. What would you like to talk about sleep as a means of good heart health?
So actually, we call it sleep hygiene. This is very, very neglected. This sleep aspect is something in the last decade or so we have been highlighting this. People with disturbed sleep, there are many people who have some sleep disorders, like sleep disordered breathing. They don't breathe properly. They snore too much. They are obese, and the daytime they are always sleepy. These types of people have a lot of diseases like sleep apneas, and we definitely have an associated cardiac disease with these types of sleep disorders. Also, those people who don't have these disorders, they lack sleep hygiene. So everyone should maintain a sleep discipline. We will just briefly tell you. You need to have a regular sleeping time. You sleep at least a good 6 to 8 hours of sleep should be good enough for any adult. But what is important is that regularity is important. Please do not see gadgets like mobiles or laptops prior to sleeping, because all that infrared light or whatever light, it disturbs your circadian rhythm and you won't be able to sleep properly. It's very important not to see gadgets prior to sleeping. We see that today most people are watching mobiles just before sleep. And other thing is not to eat a heavy meal just before sleep, and give a gap of at least half an hour to 1 hour before sleeping, so that even your stomach also doesn't get upset. So not to have tea or coffee late night. Just go for a small walk before sleep. This is called sleep discipline. We call it sleep hygiene, and this will definitely go a long way in maintaining a good BP and maintaining a good healthy life for you.
Yeah. So moving across from
Sleep, to add up sleep.
yeah.
See, of late we are seeing a lot of software professionals. They have the night shifts. So
Correct.
especially BPO workers.
Correct.
So these people, I see a lot of people. They come with some personal disorder. They become totally disturbed personality. They become very restless. Palpitations. Their heart rate is high. BP is high. And I see a lot of new hypertension in this subgroup of patients. In this subgroup people, when they talk to them, what they say is, daytime they will be a BPO, they go for the night duties, and daytime they won't sleep properly because in the family they don't have the conducive atmosphere to sleep properly. This is a wrong thing. One, sleep is very much essential. You cannot neglect only for the profession's sake. If you are doing a night duty, you have to see the appropriate daytime. You have to sleep in a sound sleep. You have to make your sleeping atmosphere without disturbance. Should sleep at least 6 to 8 hours in the daytime. So if you are like that, it's a very much essential for your life. If you want to work in nighttime, doctors will never say no, don't work nighttime. If you want, you can continue, but you have to see that daytime duties, the daytime sleep is very, very important. Second important fact is the nighttime cab drivers, the truck drivers and cab drivers. I have seen a lot of people, especially truck drivers, developing heart attack because these people, these truck drivers and cab drivers, they go for night duty and daytime they'll never sleep. Again, they go for the night shifts, and these people, their assessment in the road will be difficult. They develop a lot of accidents happen in this subgroup of people. So all these truck drivers and cab drivers should know that at least 8 hours sleep is very much essential for their safety and the passenger safety. And whatever the companies who hire them should give them appropriate time to sleep. They should not encourage them to do 2 shifts in the daytime, nighttime. This really is a request because this occasion I should tell this.
Having talked about risk factor, I think it goes beyond doubt that a lot of clarification and emphasis has to be on quitting smoking or use of tobacco in any form. So your inputs, Dr. Keshav.
See, smoking, as a cardiologist, last 20 years, we're seeing a lot of angiograms of the smokers, non-smokers. It's a clear conclusion that smoking is the most dangerous habit of a human being. Smoking, if you ask, it can cause any disease on the earth, starting from the diabetes, starting from the hypertension, starting from the heart disease, cancer, anything for that matter. From the hairs to the toes, that's what when we talk, talking on the dangerousness of the smoking. Such a dangerous thing is the smoking habit. The smoking, there is a few things like a person moment we say we tell about to quit the smoking. He thinks that, sir, I already smoked for 20 years. Anyway, already it's not going to benefit. No, smoking at any stage, one should stop. Once they stop smoking, the benefit will start happening on the same day itself. After 2 years of completely quitting the smoking, a person becomes totally normal, almost like a non-smoker stage. So smoking is the most dangerous thing. One has to quit smoking at the earliest, whenever the occasion comes. Second thing is I want to speak about passive smoking. See, the awareness of passive smoking is so good in Western countries. They have a campus of zero smoking, like under 200 meters no smoking zone area, like 300 meters no smoking zone area. So much of things they put laws and bylaws in place. In India, we don't have any bylaws. Anybody can smoke in our premises. Anybody can smoke in our nearby place. We don't have anything to object on them. So on this occasion, I stress on every individual, and even if they can pass a resolution that smoking should not be there any of our living premises. Because so dangerous is smoking. The passive smoking almost contributes to around 30% of the heart diseases in the population. Such a dangerous situation to passive smoking, especially if they're smoking in the house, especially the kids, small kids exposed to smoking. one of the risk factor for the when they become adult, the heart disease are in the adult. One of the risk factor the childhood passive smoke exposed is one of the reason for the heart disease in the when they become adult. So smoking is so dangerous. Smoking, one has to quit smoking. One has to take precautions to avoid passive smoking.
Just a couple of points. See, there are people who are very proud that they say that, oh, I was smoking 20, now I'm smoking only 1. So according to them, they have quit. Actually, they come and say, no, I have almost quit and they have reduced. So they think that that is not enough. See, the cigarette smoke, as we all know, contains thousands of chemicals, almost some 3,000 dangerous chemicals. So that even one cigarette, we have seen patients who have never smoked and just come with a heart attack just after one cigarette. So tobacco in any form could kill a person. So it has to be a zero. The smoking should be a complete zero. And that is one thing. Second thing is, there are people who are unable to quit. Actually, they are unable to quit because they are so much dependent on that. So there is a craving. So they become physically dependent on that. So they live for a few months and again start going. There is medical help for people like you. I mean, for people who are unable to quit. See, we have so many medications available now. We have lozenges, gums, and even there are some medications which act on the brain and they reduce your craving. Please take medical help if you are unable to quit.
Yeah,
that's very important.
Regarding quitting smoking, there's equal important responsibility from the families to support them, because once they could have been a patient but they feel that there's a stress on them, why don't you quit smoking, but it is very difficult for them physically to get away from it. So some amount of support from the family, from the community, and they should be, because there are so many new resources available, they need to use them to quit tobacco in any form. That is the key word.
One more thing, tobacco in other form like tobacco chewing. It's become a new fashion. Snuff and tobacco chewing. The big Hollywood actors are giving advertisement in the big banners that tobacco advertisement promotions. It's very disturbing. Being such a learned people, so much of earned people should not promote tobacco in any form like tobacco chewing. I think this government should take action on that. One should not promote the young generation to use tobacco in any form, especially the drivers, cab drivers. They use the chewing tobacco very commonly, and they should discourage it. We should educate them that tobacco in any form is dangerous, equally dangerous. Not that smoking dangerous, to chewing tobacco it's safe. Nothing like that. Tobacco in any form is equally dangerous.
I think, as we discussed, the government has a major role to play here. They have to make this smoking a punishable offence, and this environment should be very, very nicely made.
Yes.
This public smoking should be, I think, it should be strictly taken.
The key discussion here is that a person has inherited risk of being a diabetic or hypertension as some genetic component. The point is, smoking, and for that matter even alcohol, adds up to the risk, which is at least modifiable and preventable. So that is an awareness which everybody should understand. At least this can reduce the risk of having an event in the future. So moving from smoking, let us move about to alcohol and heart diseases. Somebody conveniently doesn't talk about alcohol because that there is everybody know this talk is always there that some amount of red wine is always good for the heart. So it has become like it is a scientific evidence, but it is really just a myth. So what would you like to talk about alcohol and heart diseases?
See, actually, this is I wanted to speak in a funny way. A lot of people they take alcohol, but they don't want to tell to doctor. So when you say, "Sir, alcohol little bit is good for heart," this is a myth everywhere across the society, saying that a little bit of alcohol is good for heart. And these alcohol friends, they encourage themselves. They add more friends to the group and they encourage the alcohol for their company. But as a medical recommendation, alcohol. Okay, that whatever the French products, the studies have shown that a small benefit in the people who take red wine, in French people, which is not been seen in the other population like Asians. That this alcohol benefit, whatever that wine benefit, the French products is not seen in the Asian countries at all. So alcohol is no way benefit to the any individuals, whatever the quantity they take. In Indian population, this is a very clear concept. And alcohol, especially in diabetics, they are very dangerous. They disturb the blood sugar levels, and especially cardiac patients, if they take too much alcohol as a dependent, it causes heart muscle to become weak, alcoholic cardiomyopathy, and this alcohol also can cause cardiac rhythm disturbance like atrial fibrillation, supraventricular tachycardia. So all these things are very common in alcoholics, and even they say even heart attacks when they binge of alcohol raises the blood pressure, and even heart attacks are common in the heavy alcohol drinkers. So alcohol should be discussed whatever the quantity. And alcohol is dangerous for the heart.
Yes, so alcohol actually, see, the scientific bodies, they do have some recommendation like 1 unit, 2 unit, they go by grams, I think, but unfortunately people don't stick on to that, and they have their own
That
fancies.
is like
They
a
have,
food recommendation.
yeah, and please remember that alcohol is actually empty calories.
Yeah.
I mean, it just gets converted into fat and just gets deposited. There's no way the alcohol is beneficial to a person. So we, as we have already discussed, with all these hazards of alcohol, social and psychological, we definitely don't recommend any form of alcohol at any extent. I mean, it's always better to be a teetotaler, I feel.
So it's important to also to tell that the World Heart Federation had come up with recently a paper or their statement on alcohol and heart diseases, and they've gone beyond doubt to say that alcohol is not beneficial to the heart. That is the key word today. So moving forward, I think we have covered a good deal of discussions on the risk factors for the heart diseases, be it modifiable and non-modifiable risk factors. And coming back to what Narayana Multispeciality Hospital.
Just like to add one more aspect of meditation. I think as a 5 to 10 minutes of meditation is something which is essential. I mean, it hardly takes 5 minutes. The person has to just go alone, just sit somewhere. Just it may not be in a temple or any place. Just he can sit somewhere alone. Just 5-10 minutes of meditation. It looks very small thing on when we talk of these things, but it will definitely go a long way.
So
in this.
the
This
relaxation
meditation,
techniques, what you're talking
relaxation
about.
meditation is also something very important.
I think Anand, you being a pediatric cardiologist, I just want you to also contribute to the pediatric heart health. Few points from your side, message on this World Heart Day.
So we've been talking about all as a heart disease as a chronic ailment. So pediatric heart diseases are mainly contributed by what is known as congenital heart diseases, the diseases which occur from birth. Around they amount to almost eight kids have heart disease among the 1,000 live births, and out of that 50% of them have critical diseases. Critical congenital heart diseases are diseases which, if not treated, the child dies in the first 1 year of life. So this is important because looking at India's population, so this number is a huge number, and in the present generation, in the present dynamics of things, I think awareness is the key thing, where in this present era of congenital heart diseases, many of these diseases are either treated surgically or treated by catheterization procedures, which are the newer advances in cardiology in the last 1 decade or so. These treatments are available across. So the main thing is appropriate diagnosis and early treatment. That is the key. So few of the conditions are such, like few defects in the heart or few holes in the heart, like an atrial septal defect or a ventricular septal defect or a large PDA, and a few other complex conditions which needs a treatment which has to be offered at the correct time. So this can occur only when there is awareness among people that whenever a child is not feeding well or is not gaining weight, or there is excessive cry, or there is a bluish discoloration of nail beds or anything like that, they need to approach their pediatrician first and then get referred to a pediatric cardiologist. And for that matter, I would like to say, in Narayana Multispeciality Hospital, we have a we offer a full spectrum of pediatric cardiac care services, be it diagnosis, be it interventional management of pediatric congenital heart diseases, or for that matter, even surgical care for them.
So the rare hope is all these pediatric congenital heart diseases, majority of them are curable, correctable. Child can lead a normal life in future. No need to lose hope. Concerned pediatric cardiologists will take care of them. So this is the one we need to give a message. Only thing is awareness. Go for appropriate time for checkups, and if they're detected, it can be curable in majority of the times. Curable.
True, and equally so, a small point here, that even that right now we even also tell all the mothers that's antenatal proper follow-up, and in high risk mothers we also do scans which is called fetal echocardiography, where any critical heart diseases are sometimes detected before birth, and accordingly suitable treatment is given. Some critical diseases may be advised for a termination, but most of them can be given appropriate treatment immediately after birth. So coming back in the last leg of our talk here, we would like to say, we are proud to say that Department of Cardiology from Narayana Multispeciality Hospital, what difference do we make to the community at large? So we had come with the new theme for this year from NH, and we would like Dr. Keshav to brief on that.
So it is a very wonderful statement, very beautiful sentence. That is a thoda dil, thoda heart. Thoda dil, thoda heart means you have some love towards your heart. Show your concern to your heart. Show your affection to your heart. It's not that you're loving, you have to show your all concern, love to one girl, go behind her. Need not do all the big things. Your own heart, you start loving your heart, show some affection, love, affinity to your heart, go for its checkup. You practice all the heart healthy habits to live long. That's the message.
You like to add in, Dr. Srinivas?
Yeah, I think so. Every year we have been doing such campaigns. So this year, I mean, we were very happy to have this nice Facebook Live, and this is the message we want to spread across. And we are also tomorrow having a walkathon.
Walkathon.
Today we are having a walkathon in our hospital. So these are all the things our hospital is undertaking, so that we spread this message across to the community at large. And we also have some mobile vans which is spreading across these messages. We are giving flyers to the people. See, essentially, we want this prevention. These prevention aspects are very important. We call it preventive cardiology. So this is what we are now aiming at.
So to add up to that, we have introduced a package, just very throwaway price, $9.99 package, which includes sugar, cholesterol, ECG, echo, treadmill test. I don't think anywhere can offer such a low price. It is mainly to touch the public, touch the normal fellow, touch the young people. You make up this use of this opportunity. Check your heart. Show your affection to your heart. Show your love to your heart. Thoda dil, thoda heart. Thank you.
Thank you. So, as we conclude the session here, we would like to express our thanks from the Department of Cardiology for spending your time to watch this program. We also want to say that the whole idea here was how to prevent heart diseases, and it is not an annual event only at the end of September. We want that this message, what has been conveyed through, has to be followed throughout the year by everyone and as much possible, and it has to be disseminated across to everybody. So, thank you all for your time and your hearing.
Thank you.
Thank you.
Thank you.
Thank you.